I also want to give you some context on another issue that is critically important to voters in this election. In fact, one of the top issues that voters say is driving them to the polls. That's health care. Watch.
What I would like to do is a much better health care, much better, will always protect people with pre-existing. So I'd like to terminate Obamacare, come up with a brand new, beautiful health care.
He's been talking about this for a long time. He's never come up with a plan. I guess we're going to get the pre-existing condition plan the same time we get the infrastructure plan.
NBC News national political reporter Sahil Kapoor is with me. Sahil, great to see you on the show. And let's start with that exchange, right? You know that my day job for NBC News is covering the White House. I can tell you that there is, to my knowledge, no comprehensive plan that the president has put out to replace the Affordable Care Act. The administration will talk about executive orders, those types of things. But what's your assessment of the context behind this here?
It is correct, Hallie, that the president does not have a comprehensive health care plan. He has talked about vague things in a document, a 10-page document he put out last month called the America First Healthcare Plan, things like reducing, cost, more choice. But he has not put policy to paper on this, and this has turned into a big liability for him. Specifically on the issue of pre-existing conditions, he has insisted that he will protect them, but he has called for repealing the ACA. And when he has supported plans in the past, the Republican-backed bills of 2017, they would weaken those pre-existing conditions, specifically by giving states waivers so that insurance companies can charge higher prices to sick people, potentially lower prices to healthy people. But that would weaken these pre-existing condition rules, and the president has never really found a way to square that circle.
On the other side of the aisle, you have Joe Biden talking about something called Biden Care, right, which is something that offers the public option, as he described, and it lets Americans on private plans have the option of basically a government-run policy. The estimated cost there, $750 billion. The Kaiser Foundation says the plan would reduce prices on ACA exchanges, lower employer-based premiums. The president claimed 180 million people would lose health care under this plan. Is the president right, Sahil?
Hallie, he is not right. What the president is talking about is the single-payer plan, the Medicare for All plan supported by Bernie Sanders and supported by various progressives in the party that Joe Biden explicitly ran against and defeated. 180 million people would lose their private insurance coverage if that plan were to be enacted, but Biden opposes that plan. What Biden does support is plussing up the ACA exchanges with more generous subsidies and adding a government-run insurance option to the exchanges so that they can compete with private insurers. There are healthcare experts who have looked at this and said it would reduce premiums and costs for people on the exchanges. It would cost taxpayers a lot of money, $750 billion, and Biden has proposed to pay for that with a series of tax hikes. You heard Biden say in the debate yesterday when the president came after him and said, well, other people in your party want this single-payer plan. It's going to happen. Biden's response, I defeated them because I disagree with them.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.